The first patient is Mrs. M. She's a 52-year-old female with a history of depression for over 10 years. She has been on Cymbalta for about a year for this, in addition to her chronic back pain. She reports that for the past 3 months, her depression has been worsening. She has started having panic attacks lasting from 5 to 15 minutes, in which she has shortness of breath, palpitations, sweating, and chest pain. She has had some increased fatigue and back pain. She does report that she has some decreased social interaction and difficulty with ADL, such as dishes, due to pain and fatigue. Her medical history includes gestational diabetes, although recent blood sugars in the office have been normal. She does not take medications daily. She does take an occasional muscle relaxer or Ultram for back pain. Social history includes that she is a widow of 3 years. She's a former homemaker. She was caring for a grandchild but could no longer do so because of the nervousness. She drinks 3 cups of coffee and a Mountain Dew daily. On physical exam, subjective review of systems reveals that she denies chest pains except for during panic attacks. She does deny a family history of hypertension. She reports decreased appetite. She denies nausea, vomiting, diarrhea, or constipation, although she does have some intermittent indigestion that she takes some Zantac for 2 to 3 times a week over the counter. She does report urinating small frequent amounts and has urgency that's been going on for about 2 years. It seems to be worsening. She admits to irritability, although she denies any serious psychiatric illness requiring hospitalization. On objective physical exam, her temperature is 99.2, pulse 94, respiration is 22, BP 128 over 82. She is 129 pounds at 119 pounds today, and she is 5'3". She was 129 pounds at her last visit, so she has lost 10 pounds. She is anxious, appearing with rapid speech. Eyes, ears, nose, and throat are normal with the exception of possible throat fullness. She is negative for lymphadenopathy. Her heart rate is rapid but regular without murmur. Her lungs are clear. Her abdomen is soft, non-tender, with bowel sounds throughout, positive. Neurologically, fine tremor is noted. She has no peripheral edema. Pedal pulses are 2+ bilaterally. Differential diagnoses include, number 1, and most likely, hyperthyroidism due to her weight loss, anxiety, diaphoresis, and possible throat fullness. Fine tremor and irritability. Testing that needs to be ordered includes a thyroid-stimulating hormone, a free thyroxine or a T4, thyroid antibodies to look for an autoimmune source of the thyroid disorder, and a 24-hour radioactive thyroid uptake scan. I believe this is most likely, as her symptoms are most consistent with hyperthyroidism per Ferries 2015. Second diagnosis would be anxiety disorder due to the presence of panic attacks, history of depression, rapid speech, reports of nervousness and anxiety. This is somewhat likely. Testing that can be done in the office would be to perform a GAD-2 to assess for symptoms and severity of anxiety and to rate her anxiety. No additional laboratory testing would be needed at this time. She should be trialed on a higher dose of Cymbalta or an SNRI and have her follow up in 3 weeks. At that time, if her symptoms do continue, further testing or laboratory work could be ordered. Third differential diagnosis is cardiovascular disease, such as atrial flutter, due to reports of palpitations and chest pain. Workup would include an EKG, cardiac markers, and serum electrolytes, possibly an echocardiogram. This is less likely due to her normal pulse and only slight elevation in blood pressure, lack of edema, and no obvious etiologies or risk factors for this. Although it is least likely, it should still be considered if it is, and testing ordered if high clinical suspicion. Question I would have for the preceptor is whether the thyroid uptake scan should be ordered now or await lab results first. Further learning includes learning about ordering a thyroid ultrasound versus a thyroid uptake scan, and the ordering a T3 versus a T4 and the interpretation of the results. Ferries was used as a reference for all of the above. Thank you.